Kinesiology taping for hip flexor strain. So there are many muscles that are involved in flexion of the hip. The rectus femoris, from the front of the hip to the knee, the psoas, which attaches into the spine and then crosses to the femur, iliacus on the inside of the pelvis, the TFL laterally, pectineus, adductors longus and brevis, gracilis, and even sartorius. So, as always, which one are we working on? And this comes down, as always, to a thorough assessment, asking where your client feels pain, getting them to show you, and then palpation will also help play a part as to where exactly and what muscle has been strained. So we're going to take a quick look at a rectus femoris hip flexor strain, which is probably the most common. It originates at the front of the pelvis on the anterior inferior iliac spine. It comes down the front of the thigh and inserts into the tibial tuberosity on the tibia via the patella tendon. So, its action is hip flexion, but also extends at the knee. This is an important nuance in terms of action, because what we'll find with a rectus femoris strain is that it can sometimes happen on kicking, jumping, somewhere where we're using both the knee and the hip. Pain is generally felt at the front of the hip near that attachment, or alternatively can also be felt the whole way down that muscle down to the knee. There could be swelling or bruising in the area, so for example in this example at the front of the hip, and there might also be spasm in that hip flexor. As always, get to know the client, their activities of daily life, what they were doing when it happened, how it happened, what shoes they were using. You might also want to look at a postural assessment, what their gait is like, and also if it's a repeated injury or an injury that happened in activity, having a look at them doing that activity can also be very telling as to why it may have occurred, why it may not be getting better, or why it's a reoccurring issue for that client. So let's take a look at the acute and early subacute phase. So here, 2 steps. We want to inhibit the rectus femoris and also desensitize the front of the hip. Other options, if there's swelling or bruising, is to add drainage in that area as well, remembering that the nearest lymph nodes are the inguinal, so ensuring your direction of travel or pull is in the right direction. So inhibition, we're going to anchor the tape away from the hip, so at the tibial tuberosity. So we peel back those first 2 inches and we're going to add them with no tension on the tape, no stretch on the tissue below the knee. Now peel back the middle of the tissue, and it's important if this is at the hip flexor, so at the top of the hip, that we cross the hip with our taping. So get your client into hip extension, light stretch on the tape, and we're going to anchor it right down and across that AIIS on the front of the pelvis. So you may want to get your client to anchor the end of the tape, because it's going to come under their underwear, or in this case, if you're doing it off the bed, then under their shorts, rubbing it well to stick. Now, client is showing me where they have pain, so it's just below that origin on the AIIS. So get your client to pull up their pants, their shorts. Now, middle of tape, light stretch, straight down onto an extended leg. So tissue on stretch and light stretch on the tissue, and anchor, or get your client to anchor with no tension at all. Now moving on to the subacute and remodeling phase. Here we want to activate the rectus femoris as we start to rehabilitate and strengthen the damaged tissues. We might want to combine it with any other postural or biomechanical issues that we're treating in our long-term plan. So for example, lower back inhibition if the client was extremely lordotic, for example. Activation, we're going to anchor at the origin towards the midline. So I'm going to anchor well above the front of the hip so that I can activate the whole length of the rectus femoris. So I'm anchoring here, no tension, no stretch. Now I need to feed this through the client's pants or shorts, so simply ask them to do it for you. Much simpler, they'll feel more comfortable, and you can ensure that you can get the tape where you need it to be. So they're going to feed it through. And you can just bring it through when they're ready. That's it. Now get your client to hold that up so that you can tape from the front of the hip down. So they're just holding their shorts and their pants. Peel back the middle of the tape. Now, light amount of stretch and into hip extension again, so tissue on stretch. Follow the line down the front of the leg and then simply anchor with no tension, rubbing well to stick.